So we're going to be covering positive visual phenomenon. Positive is different than negative. Positive, the patient sees something. Negative, they don't see anything. So a positive visual phenomenon, the patient will say, I see something, a flashing light, a jagged line, something like that. And when patients complain about positive visual phenomenon, it's good to ask them to draw it. We'd like to know if it's one eye or two eye, that is it bilateral or unilateral? In general, if it's unilateral, it's in the eye. And if it's bilateral, it's in your brain. The most common unilateral positive visual phenomenon that we have are called entoptic phenomenon. Ent means in, and optic means eye. And the most common causes of entoptic phenomenon are vitreous traction, posterior vitreous detachment, retinal detachment. So patients with retinal detachments or posterior vitreous detachments or floaters might say, I see a flashing light. So the retina cannot make a formed visual image, so it either makes flashing lights or nothing. That's pretty much what it can do. So unilateral, we were thinking about entoptic phenomenon, flashing lights. If it's bilateral, we'd like to know the character of the phenomenon, and migraine is a super common bilateral, simultaneous, and often hemianopic positive visual phenomenon. The key and differentiating feature is the geometric nature of the phenomenon, which we call a fortification scotoma because it looked like an old fort would look like in the old days. And it typically starts small, gets bigger, and moves across the visual field. And that we call march and build up. There might be colors in it, and the colors might be flashing off and on, and that's what we call a scintillation scotoma. So a bilateral, geometric fortification, scintillating, colored or flashing scotoma that starts small and gets bigger, lasts about 20 minutes, and then the headache follows. That's going to be compatible with migraine. In contrast, occipital seizure usually is not this jagged line. It usually lasts seconds at a time, and it's geometric, small little circles. So small colored circles, seconds at a time, bilateral, simultaneous. That is almost always occipital in origin, and occipital seizure is what we're going to be worried about. Last seconds at a time, they might have mental status changes or generalize. So if you just knew these three main categories, entoptic phenomenon, migraine or an occipital seizure, that's most of the positive visual phenomenon that we see. And you got to differentiate it from photopsias, which is just, I see a flashing light, and that is almost always a retinal sign. So positive visual phenomenon, mostly migraine. So we talked about positive visual phenomena that come and go. There are other positive visual phenomenon that you need to know about. And one of them is a formed visual hallucination called the Charles Bonet phenomenon. So as opposed to an illusion where you see something but misinterpret what you're seeing, a hallucination has no visual stimulus. So Mr. Charles Bonnet's grandfather had vision loss, and then after that he started seeing people, like a man with a stovepipe hat. And so the Charles Bonnet phenomenon, people have vision loss. It doesn't matter what the cause is. Usually it's moderate to severe, but can be as little as 20/40 vision loss. They see formed visual hallucinations, people, animals, sometimes geometric figures. Sometimes they're unformed, but usually it's people. They should be able to recognize the unreal nature of the phenomenon. That is, they're not paranoid or crazy. They know it's not real. They shouldn't talk, and that person normally doesn't talk to them, so there's no auditory component. And there's no delusional construct. There's no backstory of why the people are there. They don't know the people. There's no story behind it. So the Charles Bonnet is a form of visual hallucination. It's a release hallucination in an awake and alert patient who has no other reason to have it, and it's usually a formed visual hallucination from vision loss. Visual snow is a different type of phenomenon where patients see this pixelation. It's usually diffused throughout their entire field of vision, and they describe it like looking through snow. It's usually both eyes, simultaneous and persistent, although it's different under different lighting conditions. The visual snow is probably just increased sensitivity to an existing visual phenomenon that most people ignore. but some people are bothered by this. Normally we don't scan it or do any tests for it, but you could do an MRI and an EEG to look for a cause, but mostly it's benign. There are a number of treatments that have been tried, mostly anti-migraine therapy and anti-seizure therapy, but it's generally benign, and most people just want to know that they're not crazy. Again, like Charles Bonet, there's no delusional construct behind it. They recognize the unreal nature of the phenomenon. And then there's this last visual phenomenon I want to tell you about, which is called Palinopsia. Palin means repeat, and opsia means see. So a patient sees the same image over and over again, a repeating image. So you might see a house, then you see the same house. It can also be a trailing Palinopsia, so they see their hand, and then when they move their hand, they still see the hand, or 3 or 4 hands. This is occipital in origin. The most common cause is no cause. However, any lesion in the occipital cortex can produce it. Stroke, seizure, tumors. And I generally do an MRI and an EEG for the Palinopsia patients. A lot of patients have used hallucinogens in the past, and it comes back. It's like a flashback. The most common is LSD. We call it a persistent positive disorder from hallucinogen, a hallucinogen persistent positive disorder. And Palinopsia is a common feature, so you should ask about prior hallucinogen use, LSD, magic mushrooms, whatever they used. Some Palinopsia patients have been exposed to medicines that were used for some other indications, topiramate, clomiphene. The clomid is the fertility drug. So you should ask about medicines in patients with Palinopsia. So these are 3 special forms of unusual visual phenomenon that sound crazy, but are absolutely real.